Hello, and thank you for joining me for another episode of You Would Think. Full disclosure, I am not an attorney. I do not have a law degree. This is a trial channel where we talk about trials, discuss them, engage in them. I like hearing from you guys and having that other perspective. So no legal advice is given. I do, however, have my degree in forensics and crime scene technology. So, today we're going to be talking about day 5 of Lindsay Clancy's murder trial. Just a little bit of background. Lindsay Clancy is the Massachusetts mother who strangled her 3 children and then jumped out of her second-story window of her home and paralyzed herself. So that is what we are going to be focusing in on today. Again, thank you so much for joining me, and let's get to it. Okay, so day 5 of Lindsay Clancy's trial. This was a day of medical professionals, consisting of therapists, doctors, ER doctors, ICU doctors. I believe that there was a surgeon in there, and in the beginning, there was a psychiatrist that spoke to Lindsay for about 20 minutes, which the defense really focused in on. And honestly, I would too. 20 minutes is not a long time. And this was before Lindsay got sent to surgery for her back. So, and then the psychiatrist had stated that Lindsay said to her, one of her first questions, because she wasn't able to speak because she was incubated. So she asked for some paper, and when the psychiatrist gave her the paper, the very first question that she asked was, "Do I have an attorney?" Strange first question, I suppose, considering everything. Not how are my kids, or do you know where my children are, or where my husband is. It was just, do I have an attorney? Take it for what you will. And I have a little clip of video from that exchange. I'm going to go ahead and watch that really quick.
Brigham and Women's Hospital. And what is a forensic psychologist or psychiatrist? Well, I'm a forensic psychiatrist by specialty training, and we work in the courts often doing forensic evaluations of individuals, but I'm also an adult psychiatrist, and I work at Brigham and Women's Hospital as an adult psychiatrist on the consult liaison unit. Can you just briefly describe your education and training background that qualifies you for this work? Sure. I grew up in the South Shore. I went to Dartmouth College, and then I went to medical school at UMass Chan Medical School. I then did my psychiatry residency at Harvard Longwood, which consists of Brigham and Women's, Beth Israel, Boston Children's at the time. And after that, I did subspecialty training after my psychiatry residency in forensic psychiatry, again at UMass Chan Medical School. Focusing in on January of 2023, were you working at the Brigham and Women's Hospital?
I was.
And specifically on January 25th, 2023, did you interact with a patient there named Lindsay Clancy?
I did on January 26th.
26th, okay. In what capacity did you interact with her? As a forensic psychiatrist or as a member of the staff at Brigham and Women's?
I interacted with her as a member of the staff, the psychiatry staff at Brigham and Women's Hospital.
Did you have a particular role that day on January 26, 2023?
Yes, I was on the consult liaison service, which is the psychiatry service that's called by medical and surgical specialties to help evaluate and provide psychiatric recommendations.
Did you meet with Miss Clancy on that day, on the 26th?
I did.
And was that around 2:14 p.m. that you had that interaction?
I think it was somewhere between 2 and 3 o'clock, yes.
When you met with Lindsay Clancy, was that in her hospital room in the ICU?
It was.
And was she intubated at the time?
She was.
And was she awake?
She was awake.
Was she oriented?
So she was intubated, so it was difficult for her to really answer a range of questions. And so she gestured to me to be able to write. And so we knew that she was really exhausted and anxious from the entire experience and the evaluation. And so we didn't ask her all of the questions around orientation.
When she gestured that she wanted to write, did you give her something to write with or something to write on?
I did.
And what did you give her?
Paper.
And did you also give her a pen or something like that?
I did.
Okay. When you asked her certain questions, was she able to answer those questions by writing the answers on the paper?
She was.
Okay. And did you ask her about her mood that day?
I did ask her mood.
And what did she write?
She wrote horrified.
And what was her affect during this interaction?
At the time that I saw her, she was intubated, and that in and of itself is very uncomfortable. And so she seemed very anxious.
Did she write anything else on that paper that you saw?
Yes, the entire evaluation was done through writing because she couldn't speak.
So what types of questions were you asking her, and what was she responding with?
So we asked her, how are you feeling? Horrified. And then she wrote down, do I have an attorney? And I said with my team that at this time, we're just getting to know you and getting to know the case. And we're not sure exactly, what is happening. And we asked her, do you have questions for us? And she asked, is my body broken? Are my legs straight? She then asked about, can she have visitors? And, where her family is.
When you are asking her questions, what is the goal of the questions that you're asking her? What are you trying to address or assess?
It depends. Psychiatrists are called for all kinds of issues that happen in the hospital. In this situation, we were asked around, diagnostic clarity, that there was a likely suicide event that occurred. Can you evaluate her for safety at this time before she goes into surgery?
I know that she was intubated, so she's writing her answers. But based on the answers she wrote on the paper, did she seem to understand the questions you were asking?
Yes.
Her responses, did you understand those?
Yes, she was anxious and she needed breaks. And I said, anytime you need a break, we can leave. But she did write to us those particular answers.
So what she was writing, even when she asked if she had a lawyer, those were things, what she was writing made sense given the situation. She wasn't writing, is there a unicorn in the corner, right?
Correct.
Like that.
What? I'm sorry, I didn't hear that. What?
There was a unicorn in the corner. So what she's asking, do I have an attorney? Are my legs straight? Is my body broken? Those all made sense given the situation she was in, correct?
They were relevant answers and questions she was asking.
Are you familiar with the characteristics of psychosis?
Yes.
What are the typical signs or symptoms of someone who is in psychosis?
It really depends, and it ranges across a spectrum of symptoms. So we have a whole category of different types of symptoms that we look at for psychosis, and they are different for everyone. But, they can be what we call negative symptoms, which are more internal, isolating, not responding, not reacting very much. And then we have symptoms like positive symptoms, that's what we call them in psychiatry, but they're a little bit more outward focused, where objectively you can see what those symptoms are, like being paranoid, darting your eyes around, responding to internal stimuli, which means you're responding to voices, and, being within a delusion. So there's all kinds of symptoms, and they look different for each and every person.
In your conversation with Ms. Clancy, did you notice any internal or external signs of psychosis?
At the time, I documented that I did not note those.
Did you also note that, she was, her thinking was linear, goal-oriented, thoughtful, and she didn't appear to be responding to internal stimuli?
Yes, that is typical language in psychiatric mental statuses, and I did document that.
What is internal stimuli?
Oftentimes, it's very difficult for our patients to be able to articulate what they're hearing. They may have perceptual disturbances like hallucinations or auditory hallucinations and maybe hearing voices. When it's really active, we often see those individuals interacting with those voices. I didn't see that in that particular moment.
So, for example, you could see someone engaging in looks like they're engaging in a conversation with someone, or looks like they're looking over at something, thinking something or someone is there when they're not. Is that
correct? That's what responding to internal stimuli is. Yes.
And you didn't see any of that present with Ms. Clancy?
Correct.
Would it be fair that some of the obvious signs of psychosis would be someone whose thoughts are disorganized, that their thinking isn't linear, that they're not making sense, things like word salad, where they're just throwing in words, making sentences that don't make sense?
So you describe symptoms that we can see in people with serious mental illness who have a psychotic disorder with active symptoms.
And you didn't see any of that with Ms. Clancy, is that correct?
Not in that snapshot moment of time.
Right. And to be clear, you only saw her for a limited amount of time on that one day, correct?
That is correct.
And this is January 26, 2023, about a day and a half or so after she's admitted to Brigham and Women's.
That is correct, yes.
She's still intubated.
Yes.
And one of the first questions she asks is, do I have a lawyer?
Yes.
Based on your training experience, did you have any thoughts about her awareness or thoughtfulness about the questions she asked or the answers she gave?
I don't know what that means, objection. Okay, if you could rephrase that.
Did you have any assessment professionally of the responses and awareness that she had?
Yes, at that time, I was trying to assess, is she confused or oriented? Is she completely disorganized? Is she so anxious that she won't be able to sleep? I was assessing mostly. I was being called into the room for that. And so there were a lot of things that I was assessing all at the same time before the surgical intervention that was going to happen. And did I answer your question?
Yes.
Okay.
In doing that and evaluating all of those things, did you have any concerns at that point in time that she couldn't make a decision to have the surgery, or that there was some cause for concern there in her behavior?
I felt she had the capability to make the decision for surgery at that time.
A couple of questions. When counsel was asking you about psychosis, apparently you've dealt with people, some of your patients, while you're working in the hospital that in fact were florid. They had psychosis and symptoms of psychosis?
Yes.
So you've dealt with people, is it a fair amount of people that would actually hear voices?
Yes, I've seen many patients that are hearing voices.
And were they, to your knowledge, were they involved with command hallucinations, things of that nature?
My patients in the past?
Yeah.
Yes.
Yeah. A fair large amount of people that you've treated over the years that have suffered from command hallucinations, hearing voices, delusions, things of that nature, right?
In my career, yes.
Yeah. And do you know whether or not there had been any indication from Lindsay as to, well, in the hospital, having any delusions or psychosis symptoms of that nature, if you know?
So I saw her, she had only been in the hospital for a day and a half.
Right.
And I hadn't heard about any psychotic delusions
And that's
from anybody.
what you saw, though. As far as you, like, how often would you see her?
I see. I saw her one time.
Once. Okay. How long were you evaluating her?
Probably because she was intubated, it was
Just asking how long?
about 20 to 30 minutes.
20 minutes, 30 minutes? And is a psychosis, to your knowledge, something that has to continue, or does it stop?
It absolutely depends on the patient. It depends on their age, how many episodes of psychosis they have had. It depends on the type of psychosis we're seeing. For some people, they can have moments of clarity, absolutely. And for some, it can be more continuous. It really depends on the patient and their illness.
Okay. So basically, you're saying that it would be case specific?
Yes.
All right. And in the 20 minutes or so that you had when you're dealing with Lindsay, were you aware of her prior medical and psychiatric history?
When we get consulted on a case,
I'm sorry, I didn't mean to interrupt you. I'm asking, were you aware of her medical and psychiatric history?
I was aware of the portion that was in the medical record before I saw her.
Okay, so that would deal with as far as postpartum psychosis?
Could you ask that question again?
When you looked at the medical record and
Yes.
when you were involved evaluating her on behalf of the hospital, because you weren't a psychiatrist that her mother or father had retained and asked to go see her, right?
Correct.
You were working for the hospital.
I was working for Brigham and Women's Hospital.
And you had spoken to a number of people before you interacted with her for the 20 minutes that you saw her while she was there for a month, right?
No.
Okay. Now, were you aware of her history of documented postpartum depression?
I was aware of mostly the postpartum anxiety that was in the record, yes.
And postpartum anxiety, the symptomology would be insomnia?
Yes.
And
handy.
did she have insomnia prior to seeing you for 20 minutes?
Yes.
And do you recall the length of time that she would be suffering from insomnia? Was it like a week, a day, a month, or what?
I don't recall the timing exactly.
Do you recall that at one point that she was on medication and actually went for 48 hours without sleep?
I don't recall that exactly from the record, that number.
Do you recall, in addition to the insomnia, that she was concerned as asking you if, in fact, her brain was broken?
She asked me, is my body broken?
Okay. Did you see in the records that she was concerned about the effect of the drugs and whether or not her brain was broken, quote unquote?
I did not see that language in the records.
How about acting on command hallucinations, conversations or statements to the effect that she was having thoughts of ideation? You knew that, right?
I did know about the ideation, yes.
How many times did she express to people that she would tell people that she had been concentrating on committing, if you know?
I don't recall the number of times.
So in any event, you know that she was insomnia. You know that there was a significant period of time that she was suffering from insomnia. You knew that she was expressing ideation. How about homicidal ideation? Did she express that?
Not from my review of the records.
Okay. Would that be indicative of a person that could be in psychosis expressing concerns about homicidal ideation?
Objection.
No. Overall, allow it.
Sorry, I don't know that question. Could you repeat that question?
Sure. Is that one of the factors that one would be concerned about as a psychiatrist if a person was expressing homicidal ideation?
I would be concerned about that as a psychiatrist.
And in fact, in this case, you knew at least about the ideation that she had been expressing, right?
Yes.
But you didn't know about any homicidal ideation she was expressing, right?
From the records or
Prior
from...
to coming to see you for 20 minutes.
I knew that there was an event that had occurred and that...
3 children died. That's the event you're referring to, right?
Yes.
Okay.
Right. Next question.
Now, as far as the period of time that she was involved with, by the way, what's hypomania?
Hypomania is sort of the gradual increase towards mania, the symptoms that we see in somebody who might have bipolar disorder. And with bipolar disorder, we see mixed depression and we see mania and we see symptoms that kind of gradually increase to mania. And we call that period hypomania.
Did she exhibit, to your knowledge from the medical records, any periods of hypomania? Excessive cleaning, exercise, or activities, being awake at night, things of that nature?
At that moment, on January 26th, I don't remember reading about that.
Okay. Do you have any memory of reading about it at all, other than that moment? As a treating physician, a doctor, psychiatrist?
I don't remember.
So what is your purpose at the hospital? I mean, you're not treating the person for any illness that they have as far as their mental condition, right? You're not treating them.
We are.
Oh, you are?
Yes.
So you're concerned about, obviously, their symptomology, if any, that they present at the time that you're looking at them and talking to them, or in this case, she couldn't talk, but...
She couldn't talk and she was going into surgery, and we had recommended suicidal precautions. We had recommended trauma-informed care so that she was getting the care that she needed. She was going to go into surgery. And then after that, we were going to continue to follow her and assess her and make sure that we were evaluating her appropriately and making recommendations to the surgical team for the care that she needed.
You all set?
Objection.
So when you're dealing with this person that's going into surgery, did you know what type of surgery she was going in for?
At the time, we knew that she was going into surgery for her spine.
Did you know what happened to her spine?
I knew that she had injuries to her spine.
Did you know that there was a transection injury, that her spine was basically exploded in T5, T6, other thoracic vertebrae fractured, including the cervical vertebrae up by her throat? You knew all that?
We were reading about it. It was all actively happening at that time.
Was she in pain?
Yes, I'm
Yes.
sure she was.
Was she on medication?
Yeah, she was on a few medications related to pain and blood pressure.
So she's brought into the hospital. You knew from reviewing her records as a psychiatrist that in fact she coded the day before, right?
I don't recall her coding the day before I saw her. I do recall from the records that she had a coding event after, I think on the 27th or 28th.
Okay, so you were not involved with her when she coded. Did you know that she had any events of that nature right after she was brought from the South Shore Hospital?
I don't know what you're referring to.
You know what a code is, right?
Yes.
Did she almost die before you saw her?
I think it was after.
Okay. How about perfusion, blood in the body, and tubes being inserted into her chest? Did you know that from looking at the records?
I think that happened after, but I
was
don't
after.
recall because I don't have the records on me.
Okay. So did you know that she had massive transfusions?
Not at the...
On this jury that it was after she saw you that she coded, had transfusions, had double tubes put into her both sides of her lungs. It's your testimony that it was after she saw you? You don't know, do you?
My understanding is the surgery happened after I saw her.
Oh, the surgery did. I'm asking you about the massive transfusions. I'm asking you about tubes being inserted so that the 300 milligrams or whatever it is of blood can be perfused and taken out of the chest. I'm asking about whether or not you knew that she had coded. I'm not asking about the surgery. Obviously, that took place after you saw her, right?
Objection asked and answered.
No, overruled.
Because that's why you were talking to her, right? To see if she could make an informed consent to a surgery, I guess.
No, I was called for the
ideation.
Okay, I'm sorry. I thought you said that you wanted to talk to her about the surgery as well.
No.
The ideation continues to this day, does it not?
Objection.
Sustained.
Did the suicidal ideation that you were concerned about continue the time that she was in Brigham and Women's Hospital?
I saw her one time.
Right, I know that, 20 minutes.
Yes.
So you know nothing about after you saw her intubated and then laying in the bed, and then you talked to her as you've discussed with the jury, right?
That's correct.
That's it.
That's correct.
How about the cops? How many cops were there?
I don't recall.
There were some, right? There were armed men in that room, were there not?
I don't recall. I think they were outside the room, if I remember correctly, from 3 years ago.
Okay, I know it's been a while. Do you recall armed police officers being outside the room?
I think I don't recall.
Do you have any memory of any police officers being outside the room where she was laying in that bed?
I knew she was in custody, and generally in custody.
No, not generally. Let's talk about Lindsay Clancy.
I can't recall.
Okay. Did you know that she couldn't even have visitors in the sense that the police would not even let her mother or father visit with her?
I can't recall.
Did you know that when you were dealing with her, was she handcuffed to the side of the gurney or the stretcher?
She had a soft restraint, according to my documentation.
Soft restraints, okay.
Yes.
Did you have any conversation with the police at all?
No.
And after you spoke to her for 20 minutes, that really ended your involvement with Lindsay Clancy until today, right?
That is correct.
Okay, thank you.
Thank you.
All right. So, and, I mean, I think that everybody can agree. I mean, you know, you can't really get a good read on somebody, you know, for, you know, when you talk to them for roughly 20 minutes. But here we are. So after that, one of the doctors explained Cora's, the 5-year-old, state when she arrived at the hospital. He noted that she never really regained consciousness and never had an independent heartbeat. Petechiae was evident, and that she did not have any brain function, or at least that her brain was severely damaged. So, she's, you know, never really came back, you know, from anything. She also had like a blue tone to her, which the doctor explained was due to a lack of oxygen. She had some bruising around her neck, which of course would be, you know, indicative of the manner of death. Considering strangled, you would imagine that there would be bruising. So, you know, those are just a couple things, especially the petechiae. You know, it's all the little blood vessels in your eyeballs that burst when you're being strangled from the pressure. So then a few more medical attempts were made to resuscitate her, and after roughly 30 minutes in the ER, the doctor had declared her deceased. And I believe that was around 7:28 p.m. Just a, you know, really sad circumstance kind of all around, you know. So then after that was Kevin Clancy, the 8-month-old. The doctor said that his pupils were fixed and dilated, which is typical indication that there's no brain function. And he also had swelling in his face and of course the bruising around the neck where the ligature would have been. He also made a comment that usually when somebody has to be incubated or have the breathing tube put into their lungs, that's a very painful procedure. And when they do that and the person has no reaction to it, like no pain receptors, just nothing, that's also a very clear indication that there is something wrong with the person's brain function, should they have any brain function at all. So that was a comment that he had made there regarding the incubation. He actually stayed in the hospital for about 2 to 3 days before he, inevitably passed. So again, just a really unfortunate situation all the way around. Let's see, and let's see. The doctor had, I believe he said he had tried a few more things to get a reaction from Callan. But he wasn't responding to those efforts. And again, he stayed in the hospital for a couple of days before he inevitably passed on. All right, and then there was an ER nurse who testified, and she stated that Lindsay had been incubated. So she had the breathing tube down her throat because they were afraid that she might have a brain damage, because they were advised that she jumped or fell or slid, down the window, whatever. Nobody's really been clear on that. Jumped, fell, whatever, out of the window. So she could have had some brain damage. And I guess when a person has brain damage, it is very difficult to get that breathing tube down their throat. So they wanted to go ahead and put it in so that it would be there as mainly as a precaution, if nothing else. They then began talking about her wounds on her wrist, and again referring to them as superficial. When the defense attorney got up, he was not very happy and said, well, did you read that she had a 3.5 centimeter deep laceration on her wrists? And I believe it was a 2 centimeter gash on the other one. She said that there was never a nick or a cut to any vein or major artery. And the defense attorney got a little brash with her because she kept saying she couldn't recall. He kept asking questions and she kept saying, I don't recall. So more so than before, the defense attorney was really wanting someone to say that Lindsay was handcuffed to the bed. But none of the witnesses really cooperated on that. I think the closest that he got was the psychiatrist, who said that she was softly restrained. And that they did that because they did not want her, like if she had, if they had to put any tubes in her, they didn't want her pulling the tubes out or something like that. So apparently if you have a brain injury, sometimes you can react by, trying to pull what's down your throat out of your throat, which is, if you think about it, it's a normal reaction. I mean, if I don't want anything down my throat, or if you have tubes in you, you're going to automatically, your brain's going to want to pull them out. I think he wanted them to say that because if you remember in his opening statement, he said that she was handcuffed to the bed and that there were officers in there watching her, basically treating her, right off the bat like a criminal. And, that kind of thing. But then we had a bunch of chain of custody witnesses talking about, how the biological evidence and the blood and the urine that they had gotten from her, how it was brought from one hospital to the next hospital, and if it was treated correctly, and talking about how it had gotten from Lindsay to the other hospital where she was at. Kevin Redington, her defense attorney, was very upset with the tedious pace of this trial. And I suppose he threw his hands up and just stipulated to the chain of custody. I will say, though, that I understand that the prosecution, wants, wanting to show how terrible, this crime was, especially because it involves children. But the defense attorney has been very vocal throughout the day and kept saying that they stipulate to this. They stipulate to that. They keep saying, this is not a whodunit. This is we know who done it, right? The central charge is why. I agree that this crime occurred and it was horrible and it was committed by Lindsay, and the prosecution is putting on witnesses one after the other after the other after the other to testify to these minute details, and it is just becoming a little overly detailed. Overly detail oriented, kind of like they're dragging their feet. So I can understand his frustration. That being said. He was able to get some information from one of the nurses about the fact that Lindsay had coded once or twice. And I think that was in an effort to show that, look, she was in a very serious, life-threatening situation, not a superficial state, right? And the best he got was that the protocol of the hospital was to have a few people in the room with the patient. If they come in having certain ideations or, being a risk, so that they were never left alone. And that was how they were treating Lindsay. So that was the reason that there were a bunch of people in the room. Doesn't necessarily mean they were cops, like Kevin Redington is trying to insinuate. Then a few more police officers took the stand and testified to the evidence that was seized from the house. Once they got their search done, once they got their search warrant, they were able to go in, and collect everything that they thought was relevant. And then they started talking about Lindsay's journals. That was the big reveal of the day, the journals. If you recall, the defense early on said that Lindsay was a very meticulous note taker. So it's no surprise that she had multiple journals. The prosecutor read some of the entries from the journals, and none of what she read was really, it didn't really help her case any, the prosecution's case. If anything, I kind of felt like maybe the passages that she read helped the defense a little more. You can tell me what you think in the comments. And I feel like maybe she read those passages because she wanted to get out in front of the defense and show them that, like, look, you know, we're not afraid of the, you know, of the defense's theory or something like that. I think they were just trying to show that Lindsay was in her right mind and her thoughts were organized enough to where she could document them and write them down in such a specific way. So the journals showed that, you know, in this time frame, that she was obsessed with Callan, the 8-month-old, with Callan's sleeping schedule, and that, and said things like, hearing him cry for 1+ hours and not intervening just about killed me. I even said the words, "I want to die," to Pat while he was crying, unquote. And I can kind of relate to that point a little bit. And I'd love to hear your thoughts as well, to all the people who are parents. Because when I had my child, the doctor said the same thing to me. He told me to let them cry, and eventually they'll cry it out. And it was like sleep training. And I remember them crying, and I was in the living room, and it was taking a lot to not go in there and comfort my child, you know? And at the same time, you want to, you know, you want to take the doctor's advice because he's a doctor. So, you know, naturally, we think that they're right. I mean, they could come out and tell us the sky's purple, and we can go, oh yeah, you know it is. You know, they're doctors. So I'd like to know in the comments, you know, some people who have maybe experienced the same thing with their children. If a doctor told you the same thing, or, you know, I'm curious. And how that made you feel. Then she said she was completely overwhelmed trying to take care of 3 kids. She wrote, "I feel like I'm drowning every day," unquote. And then she wrote an entry that was dated November 18th, 2022. And she wrote, "It's like I'm so desperate to get a mental break from taking care of everyone that my mind is trying to make something physically wrong with me," unquote. And if you remember, In the Commonwealth's opening statement, they stated that Lindsay was tired of living the life that she was living, and she was trying to escape from it. So I think those entries helped the prosecution's case a bit. But again, it also aided in the defense's theory that Lindsay knew something was wrong with her mind and was trying to get help because she did not want to fail her children. Take a short look at that.
I now have horrible insomnia and anxiety, which is causing depression. I have no appetite. I don't know what's wrong with me. I want help. I want to be well. You saw that in there, didn't you?
Yes.
And then she went on and said, I think the anxiety started after sleep training. Doctor said it was okay to let him cry. I need to get a good night's sleep and take care of him, rocking him to sleep every nap in bed in the middle of the night. She noted that, right?
Yes.
Noting further in separate occasion, he's still a very happy baby despite his sleep training. Why I feel guilty is not really hitting his milestones, not rolling over, although he almost is, exclamation point, and he's babbling, which is a new milestone. She wrote that, right?
Correct.
She wrote, I have crazy brain fog. I feel like I can't make a plan. I can't carry it out. Like I just live moment to moment, waiting for the next nap time. I'm terrified of Cal getting overtired now because I feel I can't help him. She wrote that, right?
Correct.
She then wrote, I'm really worried about going back to work and not being able to function with the brain fog. I feel like I should start with a 4-hour shift and see how I do. I can't tell if I am withdrawing from Ativan and Benadryl, or is this my new baseline? I feel completely disconnected with my baby. I feel like I'm going through the motions every day. She wrote that, right?
Correct.
And there were a number of other entries that you put in your police report about that, one of which was that I feel horribly guilty about my marriage. I want to connect with Pat again. I know he needs it. I need it. I'm terrified because I'm terrified of the relationship. She needs to get birth control first. She made reference to her inability to have conjugal relations with her husband, right?
I believe so.
She indicated further on into her travels, I am completely overwhelmed trying to take care of the kids. I'm drowning every day. I feel guilty that I'm spending my family's money and not making any. I feel like I spend way too much. She wrote that, right?
Correct.
I'm terrified of Callan getting sick. He's a sick baby. A sick baby is miserable. He's sick now with a double ear infection. Clearly has a bellyache. It's miserable. I feel like the other kids are going to get him sick all winter long. She wrote that, right?
Correct.
I always feel strongly against sleep training. I feel like it's abusive to let the baby cry and not respond, but I made the decision. I did it with Cal. It is way too much crying. It's incredibly stressful. She wrote that, right?
Correct.
He's okay. He will be okay. It's not harmful in any way. The doctor said it was okay. Plenty of people sleep train their kids at that age. It's necessary as a third child, is what she wrote, right?
Correct.
I feel incredibly sad and guilty about not breastfeeding anymore. That was the one thing I could do to help his immune system, and I can tell he really doesn't like the formula. I'm very sad about this. I know at this time it's what I needed to do for my mental health. She wrote that, right?
Correct.
And then the statement started getting smaller and smaller as time went by. One occasion, it's like I'm desperate to get a mental break from taking care of everyone. My mind is trying to make something physically wrong with me. My mind never shuts off. It's constantly thinking of the next thing someone needs. I can't shut it off. I desperately want to go back to work, but now I don't know how I'm going to function, and it worries me. Wrote that, right?
Correct.
There were two pages that were blank that she didn't even write on. And then on the third entry, affirmations. She wrote affirmations. On November 22nd of 2022, I am calm. I will remain calm today. There is nothing that needs to be on my mind. The weight is lifted from my mind. I will sleep tonight. She wrote that, right?
Correct.
Continuing on into November, I slept well last night. I will sleep again tonight. Today will be a great day.
Okay, so that was how we wrapped up day 5. So please join me tomorrow we'll be doing a summary of day 6. And thank you so much again for joining me for another episode of You Would Think. Please remember to like and subscribe, and put any comments or questions in the comment section. Thank you again. I hope everybody has a good night. Thank you.